What a great pleasure it is to be able to join you for this wonderful event. I thank you for that generous introduction. I want to especially thank our hosts, the Global Health Council and the Management Sciences for Health, for the opportunity to provide our thoughts on the priorities for the next WHO Director General. What an exciting day, huh? I was telling folks earlier that this was my first WHA, obviously, but the first time I had the opportunity to cast a vote for Director General, and the individual I was speaking with had been in the organization for a long time. Said my first time too. So it's an interesting dynamic that has occurred. We're looking forward to a very eventful day. First, please allow me to say that the United States strongly supports the WHO. Together, we're working to combat diseases and to ensure the highest attainable level of health for all people. We know that the next health emergency is not a question of if, but when. And when it happens, the world will turn to the WHO for guidance and for leadership. We need to be sure it's up to the task. By ensuring that all countries around the world can prevent, detect, respond to, control, and recover from disease outbreaks at the local level, we can minimize the threat of international health emergencies. The United States looks forward to working with the next WHO Director General, who will play an intrinsic and a critical role in preparing for and reacting to potential and actual health emergencies. We will work together to promote and achieve global health security. To this end, it is critical that the Director General manage the political sensitivities between the WHO's regional and country offices versus its headquarters. The response to the various post-Ebola reviews have led the WHO to set up promising processes to try to ensure that public health decisions will be made based on science, insulated from politics, but the new Director General will need to reinforce these systems. Furthermore, the next Director General must continue efforts to make WHO more effective, accountable, and transparent. The WHO must be transparent in how its resources are spent and whether and what results are being achieved. As we have the means to do so, we must demonstrate responsible allocation of those resources with a much greater degree of accountability. We live in a world that demands the full benefit of cutting-edge technology. Unfortunately, the WHO human resource system has not necessarily kept pace. The next Director General must work to bring the system into the 21st century. Now is the time to update and to innovate. My vision of WHO would be to make it a place that attracts the best, highest qualified people with the most state-of-the-art expertise from around the world. It should create additional flexibility to bring in highly qualified technical staff who can work quickly to develop recommendations and solve problems at WHO and then return to their home institutions. A short-term contract at WHO should not become a guarantee of lifetime employment there. That does not create the WHO that we all need. Staffing decisions should support a global institution with expertise and experience that will ensure WHO can best achieve its mission. Within the U.S. government, our international agencies have separate staffing systems, such as the Foreign Services officers and the Civil Service officers. WHO should think about the expectations it has for its staff and what differing demands and support are associated with those differences. WHO needs the brightest minds and the most skilled technicians to be able to defeat diseases such as polio. With polio, it's proving extremely difficult to defeat the last few cases. It isn't going to be easy, as you all well know, but we're on the cusp of ending this disease, and it's critically important that we remain absolutely vigilant and work to finish the job. If we succeed, it will be a remarkable, historic win for global health. If we fail, the repercussions will be significant, especially since we are agonizingly close to our objective with just a few dozen cases reported each year. Failure would put in danger other ambitious global goals, so we must remain prioritized and focused. Along those lines, WHO must assess what it means to fulfill its mandate to be a global convening body and a coordinator on global health. NGOs, religious institutions, foundations, and the private sector not only provide much of the clinical care, but they are the drivers of innovation and efficiencies in our health systems. We passed a policy last year on the WHO's framework of engagement with non-state actors. To that end, governing bodies and the Secretariat need to think about what WHO's comparative advantages are and how it can become more focused on the needs of member states and not try to do more than it should or can. WHO must become focused on its core mission. Making this happen will require additional discipline and focus from the governing bodies and clear direction from the Director General about global health priorities. In conclusion, the WHO must prepare for the next generation of challenges focused on the future, not on the past. We look forward to working with the next Director General on these priorities and to achieving our common goal of a world that is fully prepared to respond to emerging threats to global health. Thank you all so very much. God bless.